Let's talk today about how to prepare for your first spine surgery consultation. Are you nervous about seeing a spine surgeon for the first time? You're not alone. It's really common, but the more prepared you are, the more you'll get out of that visit. So in this video, I'll walk you through how to show up informed, confident, and ready to take control of your care. Hi, I'm Dr. Deeptee Jain, and I'm an orthopedic spine surgeon. I've helped hundreds, if not thousands, of patients navigate the diagnosis and recovery of having a spine problem, including the surgical part. If you're facing the possibility of surgery, this first visit matters a lot. Let's make sure you know the right questions to ask and how to make the most out of every minute. This isn't just an appointment. It's your chance to understand your conditions, what your options are, and what your recovery might look like. It sets the tone for your care plan. The more informed you are, the more empowered you are to make the right decision. And keep in mind, you are the only person as the patient that can make the decision. No one else can make that decision for you. So let's start out by talking about what to bring to the appointment, as this is critical. So you need a copy of your imaging, MRI, CT, and or x-rays of whatever part of the spine that we're talking about. So this is actually really important and can be challenging, especially from the spine surgeon perspective. So from a patient privacy perspective, it's actually really difficult to receive images, and I mean the physical copy of the images from different imaging centers. So it's really helpful if you bring a CD of the MRI, CT, and or x-rays in addition to the reports. Bring a list of medications that you're currently taking. Bring notes on your symptoms, what hurts, when, and for how long. A list of treatments that you've tried so far. Might that be physical therapy or different kinds of injections or medications? And don't forget, a notebook to jot down notes during the visit. I will tell you personally, as someone who is in the healthcare profession and has been a patient, even I cannot keep track of everything that the doctor tells me during the visit. So taking notes can be incredibly helpful. Don't be afraid to ask questions. You can ask, "Doctor, can you figure out exactly what's causing my symptoms?" I'll tell you, as a spine surgeon, sometimes it's really obvious, but sometimes it's not. Are there any non-surgical options left to try? What type of surgery are you recommending, and why are you recommending that type of surgery? What does recovery look like? And what are the risks of surgery? What are the risks if I delay surgery? You don't need to become a radiologist, but it would be nice to understand the basics. So ask your surgeon to walk you through your imaging and explain how it connects to your pain. Oftentimes, as a spine surgeon, our job is to match what the patient is complaining about and what we actually see on the pictures on the computer screen. A good surgeon will take the time to make sure that this makes sense to you and that what we see on the computer screen actually matches your symptoms. There are lots of different kinds of spine surgery, and there are lots of different ways to do it. And sometimes one isn't necessarily better than the other, and they're not all the same. In large, broad terms, that could mean microdiscectomy versus spine fusion versus disc replacement. But even amongst that, there are lots of different ways to do those individual procedures. So for example, if you're talking about a spine fusion, there are many, many ways to accomplish having a spine fusion. And a lot of it depends on surgeon preference and surgeon training. So make sure that you understand the procedure that's being proposed and what the alternatives are and what the risks are of that procedure. Finally, also, pay attention to how the clinic treats you. Do they answer your questions? Do they rush you? Are they open about the outcomes and the risks associated with surgery? And make sure that you're comfortable with the surgeon and their communication style. It's equally as important as the credentials. A lot of times, as a surgeon, I'm doing a spine surgery that a lot of different other surgeons can perform, and I'm sure that they perform them well. So I tell my patients that it's really important that they're comfortable with me and they have trust in me as a surgeon as much as my surgical skill. So next, I think it's really helpful to bring a patient, a friend, or a family member, or what I like to call a care coach. This is one of the most important conversations that you're going to have. And the decision to undergo surgery, I tell patients, is bigger than the decision to get married. You can take back getting married, but you can't take back what a spine surgeon does to your spine. And it's easy also to miss details when you're nervous. Bringing someone to the appointment that you trust who can help listen, take notes, and help you remember what was said can be especially helpful. So, in summary, make sure that you remember to bring your imaging and your notes, and by imaging, I mean CDs as well as reports. Ask specific questions about risks and recovery, understand your diagnosis and the procedure that's being proposed, and make sure that you feel heard, not rushed, and that you have a good rapport with the surgeon and the surgeon's office. So if this helped you feel more prepared, give a thumbs up and share it with someone who might be facing a spine consultation as well. Drop a comment with the biggest question you want answered in your visit, and I'll help you think through it.